So mental health cuts across all departments, all disciplines, and we need enough mental health workers. We need even the ordinary health workers to be aware, cognizant that any patient can be potentially violent. The work of a mental health person is like a priest. Like now, when somebody is just talking too much and disruptive, the first thing in my mind is this person may have a bipolar disorder or a manic episode. Yeah, but people should not fear us. We are just okay. So many people need mental health, but they stigmatize.
Yes.
They put a lot of stigma. There are some people who come to me and say, please don't tell anybody I am seeing a psychiatrist. Can you just call yourself a general doctor? I say, no, I'm a psychiatrist,
Welcome to Daktari, where voices, perspectives, and sounds relating to healthcare practitioners and matters health are amplified. This is a podcast by Daktari Online, created for healthcare professionals across Kenya. Each episode brings you honest conversations, expert insights, and real-life stories from the front lines of care. Welcome back to the Daktari podcast. With me, I still have Dr. Makanyengo, a consultant psychiatrist. In this segment, we're going to touch on innovation, policy, and her experience at the Kenyatta National Hospital, as well as the CEO of Oasis Mental Health Hospital. So my first question to you is, now you've spent over 21 years at the KNH. What was that experience like?
Wow, I can say I joined KNH. I was fairly green in managing a department. When we are trained as doctors and trained even as a specialist, we were not really trained in managing facilities. It was mostly clinical. So, but I learned on the job. And let me say, Kenyatta National Hospital is one of the best facilities, I would say, in this country in terms of nurturing you, training you, coaching you. I learned and I became where I am basically from that, because then you have to learn management, you have to learn, they'll train you on the clinical aspect, on your specialty aspect. They allowed me to be able to come up with innovations, the courses and also the kind of trainings for the staff in my department, and they train you in leadership. So I grew in Kenyatta National Hospital. And it was, I would say, my best experience. Yeah, tough, but good. I think that toughness was good. And I loved it during the time we had this, they introduced the performance indicators, where you had to really now deliver your do your performance, the outcomes and the indicators. I think it pushed people, and I saw just a turnaround. Yeah, but I can say I enjoyed my work at Kenyatta National Hospital.
Okay, yeah. And still now at that KNH, there was a place where you're now to decide if you're going, what you're going to take. We dropped, I still get that to be a great decision that you made at the time. Mm-hmm. You decided not gynecologist, you decided not pediatrician, then you settled for psychiatry. And then at KNH, became an instrumental towards HIV, psychiatry, gender-based violence. You've also said general, psychosocial,
yeah.
Mm-hmm. No, so what led to that?
In fact, when I went to specialize for psychiatry, I didn't work in Kenyatta. First, Mathare. So I worked in Mathare for some time. And then a short time posted, because there were no psychiatrists, very, very few, posted to Homa Bay. Mm-hmm. So Homa Bay is where I was the district psychiatrist, for 2 years. And I could say I started learning there. Mm-hmm. Yeah, and interestingly, there were not as many psychiatric clients as in Nairobi, Mm-hmm. But after my working there for 2 years, then I moved to Kenyatta in 1995 as a psychiatrist. Yeah. Now I headed this department. Initially, there was the mental health, mostly HIV counseling, some psychiatry, but then now we had to enlarge it. we had to enlarge it to include child and adolescent, because by then we didn't have child and adolescent counseling. We had to have HIV psychiatry, because we knew that HIV was such a problem. Remember, I talked how I mentioned how doctors used to fear to tell the patients. They would just come, and then you're the one who has to start to give them the bad news. But then we thank God, by the time, but soon after, we had ARVs. So now we had to do HIV psychiatry. I was very much involved with the Ministry of Health and the physicians and other specialists to come up with protocols, guidelines, and national policies and guidelines, so that after that we set up model centers for HIV counseling, for psychiatry model, and then the Ministry of Health used our center to train the whole country. So we would be carried along. You go to Naivasha, go to Kisumu, go to Mombasa, and soon after that you found these HIV clinics were now established. The VCT started in our place. The VCT started with our office. So, because we lobbied, there was Dr. Mulindi, who was, he's late now, Dr. Bukusi, who's my colleague, still a team of us. We had to lobby with the Ministry of Health to push so that you don't test somebody without counseling, because people used to test and then give them the bad news, and they would commit suicide, they get into alcoholism. It was chaotic. So, and I think that's an innovation. I could proudly say that started in that department, and Kenyatta National Hospital played a key role. I would proudly say that. So that's HIV psychiatry, child and adolescent psychiatry, gender-based violence, and then just medical psychiatry, because we found in all the departments there were mental health issues. Orthopedic, there are people who had trauma. Pediatrics, there are children who are abused. Sometimes you find a kid who was abused, depressed. Gynecology, postpartum psychosis. So there was mental health in all the departments. And that's where I could say a really good, because then you now get exposed to other mental health in other areas. Yeah.
And now, talking about models, if we could touch more now the comprehensive care unit and how, integrating it, you even establishing it, you and your team, of course, if we could touch more on around it being helpful in the HIV, psychiatry.
Because initially we didn't have ARTs, so they would be sent to our office. We had a very small office, and we gave them a room. We said that will be the HIV clinic. So the patients would come there. Then they became so many. So what we did, we recruited a counselor, a nutritionist, and initially there wasn't ART. So basically just be counseled how to prolong your life through spirituality, good diet, exercise, etc. But then when the ARTs came, now we got in doctors, and we started the first clinic in our office. Then the patients were so many, so the hospital had to give a big building, renovate it, and then the donors came in. And we started, and it's running now, the HIV clinic at the CCC, which now was a center training people all over the country. I remember a group of doctors came from Pakistan, because by then they didn't have HIV clinics, to learn what we were doing. We've had people come from Uganda to learn we've had people come from South Africa who are coming to learn how we set up this CCC, comprehensive care clinics for HIV. And proudly I can say Kenyatta National Hospital was very key in enabling us to come up with this innovation that has spread all over the world. Yeah.
Okay. Now, I know you've already mentioned some innovations, including the CCC. Yes. Yeah. Now, what are other, more innovations or new models that you also led? During your.
We were very much involved in when there were disasters. We were very much involved in providing psychological care, trauma counseling, and we had to come up with innovations. Like we went to Sierra Leone with the military mental health team during a war, and in this place we had to counsel the military, and we arrived there thinking we were only going for Kenyans. We found the Indian military were there, the Pakistan, the Nigerians, the who. So we had to come up with innovations through debriefing and counseling in groups, and then training at the same time, and they loved it. Even the British military team were there. And I would say that's just one among the many other innovations, Gender-based violence also, there was the gender-based violence services in other private facilities, but we felt Kenyatta National Hospital needed to have a GBV center also. Now, interestingly, we have been seeing GBV patients, that's gender-based violence, rape and such, for years. But then we realized they needed a specialized package. So the service right now started during my time, where we have a specialized program in outpatient casualty. So when they come into casualty, they get a specialized treatment. Then there's a ward that would also give them specialized treatment. And then the counselors from our place coming in to work with the Department of Reproductive Health, that's Obs and Gyn, to offer a holistic care for these traumatized men, children, women. Yeah? Yeah. And the innovation is that we were also working with the police. We brought on board the police. They would come in, the police, the civil society, the lawyers who work with the NGOs. And we would have meetings there and then just discuss the cases and then have them go to court. And many of them were successful. Yeah.
Interesting. That is, I sense a journey of growth, a journey of, curiosity, and even being exposed to more, scenarios.
Yeah.
You had to even push yourself further. And even the fact that what I'm really now borrowing from you is the heart of innovation and leading newer, and coming up with more, because they still stay today. You've mentioned, I'm like, I read that, and now I'm sitting here with one of the people who, led that, and it has truly been helpful for people, because I can only imagine someone not even having to be cancelled before testing, and they find they have it. Of course,
devastating.
Exactly. Yeah. And now talking about now specializing and giving special groups their own space, and still now something else that you've really talked about now, the holistic nature. This leads to my question of, do you feel like mental health is now integrated in now the health care?
I really feel not fully, but I think right now the Ministry of Health, and we have a wonderful director of mental health, and the team and the Kenya Psychiatric Association have done a marvelous job in pushing and lobbying so that mental health is integrated at the primary healthcare level. But in policy, that in guidelines is there. But now what we need is the personnel to implement. You need the people on the ground, the medicines on the ground. So if only we can do that. I'm not in the Ministry of Health, but I'm a member of the Kenya Psychiatric Association, and we partner with Ministry of Health, so that you go to a health center and you can get mental health. You go to a dispensary, you can basic mental health. In Wales, we need to train our staff all over. Basic screening and simple counseling, of which you can refer a complicated case. And that's my desire as a
You've mentioned something really important, the fact that you feel like fully we haven't integrated mental health care. And now what gaps do you, if you can mention, briefly, the gaps that you feel that exist, in the care of mental.
Okay, I'm not really in ministry as such, but from what I see from my end, we still do not have enough psychiatrists. Like if I look at just Homa Bay, where I come from, there's no psychiatrist in Homa Bay, there's no psychiatrist in Migori, I don't think so. I think there's a psychiatrist in Kisii. So now when I go up country, I offer services there's an Oasis hospital in Homa Bay, where I now go and I tell them, okay, anyone needing, come, but that's once a month. So we don't have enough personnel, and but we need to train, because you can train a doctor on basic screening, and they can do it. So I think the gap is there, and I think the government is trying to look at it. Yes.
Okay. Now, taking you back to KNH, your time there, can you share a story from those early years, a moment that reminded you why these services are important, possibly a patient's experience, that deeply, stayed with you?
Oh, yeah, I was in the ward taking care of a patient, a medical ward. Then on that particular day, I remember our pastor, the chaplaincy from the chaplaincy from other hospitals, other churches who come in, was coming to pray for a patient, and then the guy takes a knife and knives him. So he had to be rushed to the hospital. So to me, that experience says that mental health is not just, all patients are potentially mentally ill patients, because this patient was in the ward for a different reason. I'm not sure if it was severe malaria or pneumonia or what, yeah. Then picks a knife and, So mental health cuts across all departments, all disciplines, and we need enough mental health workers. We need even the ordinary health workers to be aware, cognizant that any patient can be potentially violent. Or can even kill. There's a story in the media where a former patient, decided to come and, kill a certain patient, So mental health we have to take very seriously. Yeah. Yeah, in any general hospital. So I remember that, and that story that everybody is potentially a mental health client, we have to be aware of that. Yeah.
And with that awareness, what did you learn about now? Teamwork, leadership, and even the resilience to even experience such a... Because I'm imagining being in that position.
You need to work with a team from the nurses, who are usually the frontliners. They do a marvelous job. They carry such a burden, and they need that basic training, and they have a lot of interest in learning mental health. I'm glad that right now I think mental health is incorporated into the nursing curriculum so that they have the basic. But then we need to allow them to apply it. Yeah, not just the bedside nursing and giving drugs, So I learned, and then teamwork. You can't work on your own. I'm a psychiatrist, I work on my own. You have to look at the chaplaincy. Chaplaincy is a huge role, because I learned that chaplaincy is not just praying. It's also getting relatives to talk to their patients, answering questions that relatives are wondering what is happening. They have a big role to play. So we need to make use of the team, the chaplaincy, the counselors, the family, relatives of the patient, and leadership, meaning you have to sensitize the department that everybody matters and everybody has a role to play, even the guard on the gate and the cleaner. Yeah. So that's an area we have to take seriously.
Okay, and just like that, you've learned that you have to work with the team.
Yes.
Yes. And now, before we get now to have more, explore the founding and growth of Oasis Mental Health Limited, I have one fun question for you, and then you also ask me a question. So my question for you is, if mental health services had a superpower, what would it be?
What or who? This is superpower.
Yes.
Well, I'm not prepared for that. Mental health.
You can also do a...
Describe to me what you mean by a superpower.
This happened when we met. When I was getting to know you, you mentioned something about yourself. So if you could get to really know, that's an example though, what really someone is going through, maybe before even they start telling you something. Or that's one. Yeah, so reading your mind.
No, by the time by the time somebody comes to you for help, they're in problems. Yeah. And the work of a mental health person is like a priest. If you read the book of Leviticus, those were priests, and even Jesus would send them. He treats them, heals them, and send them to the priest, who would actually check the wounds and all these things, the lepers and everything. I think mental health workers have a big role to play. We're almost like, some people look up to you like you're almost like a priest. Yeah. Sometimes you go beyond your clinical work, and sometimes you have to address the spiritual issues, the social issues, the family issues, the trauma during childhood, the pain they're having, So I would say, I would call that as a power. Yeah, so as a mental health worker, you need to get spiritually, sometimes you have to discern. You just see somebody coming in and something tells you something. The person may not speak, or the person may speak, but there's something that tells you that this person has a problem or is like this. But I think with practice, we all have gifts. We are all able to sharpen our abilities to discern. It would really be good. And I think everybody has the ability to discern, only they don't know.
Okay, a question for me.
I had a question which I even forgot.
Please remember.
Have you ever felt the need to see a mental health worker?
Yes, I have.
Oh, thank you for being honest. Many people hide.
No, yes, I have. I have, and actually, I'm even planning to meet him soon. I wanted virtual sessions, but then he recommended first we have the first session to at least be a physical one, and he also mentioned that it will be lengthy and all that. But yes.
And you know, Kerubo, so many people need mental health, but they stigmatize. They put a lot of stigma. There are some people who come to me and say, please don't tell anybody I am seeing a psychiatrist. Can you just call yourself a general doctor? I say, no, I'm a psychiatrist, you know. And mental health should not be an embarrassing thing. It's just like heart health, physical health. Any health, you know.
Actually, it touches in, as you mentioned, holistically. It touches in almost everything.
Yeah.
Even in when it comes to social life, mental is still there. Financial, mental is still there because you still have to be.
There's no health without mental health.
Exactly. Yes.
World Health Organization have said no health. If you're healthy physically and you're not healthy mentally, you're not healthy.
Yes. Even in spirituality, if it's not balanced, it will still affect.
That is part of holistic.
Yes.
Yeah.
Now, on Oasis Mental Health Limited, what was it like transitioning from being now a clinician to a CEO?
No, the story is that I recruited a number of doctors to come together to contribute shares to put up our own hospital because we felt there's a gap in having a holistic. It's a big gap, you know, a facility where you can go and not feel like you feel at home. You know, you're getting treatment, but you can go and you get treatment, but it's a place you can have your laptop, you do your work. It's a place you have games, you can wear your own clothes. So we got together to put up Oasis Mental Health. That is in 2017. And which opened its gates in August 2017. So initially, we were not able to afford a CEO, so I just helped in, just tried to manage the facility, which has been growing. And now we have a full-time, we actually call her operational manager, and I think you'll meet her, Celestine, who's doing a marvelous job. But let me tell you, it's a lot of work being a CEO. I would say our training is not so much, we didn't do as medics so much of the training. I would urge that if doctors come together to put up a prayer hospital, engage somebody who's trained in that line so that you can focus on your health. But I think God was with us. We were able to expand and grow. A few hitches for any business, they say if you can survive 5 years in any business, you will survive.
Yeah.
Is it most new companies they collapse after 3 years? Yeah. And now from 2017 we are almost 7 years. So God is with us, but it's a struggle in this economy right now. A lot of people don't have money. The times are tight. Insurance companies are not very easy sometimes to get, yeah. But I think grace of God, we are moving on. We are taking care of our patients. Yeah.
And now you mentioned that there was a gap that you had figured with you and your team. Now, was that met after now opening the Oasis? What changes in mental health awareness and even the access have you witnessed since it started?
Yeah, naturally, like in any job, you learn through the gaps in administration, in management, in clinical provision. And we are learning a lot. And we thank God we have partnerships with people who are really helping us. But that, again, depends on the leadership. So I think we are doing fine, yes, and addressing the gaps as they come by. But partnerships are so important. Networking is so important. So, and then digital, we have not been very good with the digital marketing and all that. But I think when we bring on board digital, what do you call it? Digital platforms and such, and digital marketing will be good to go. But I can say we are trying. Yeah, grace of God is with us. And we preach about holistic care. You come into our hospital, you'll be assessed, you're going to get psychological care, you're going to get dance therapy, you're going to have physical exercise therapy, you're going to have sculpturing. And I know somebody's going to talk about it. I don't want to talk about it more. The occupational therapist who's coming. And a lot of activities, music, and all those.
Okay.
Yeah.
And now that leads me to your presidential recognition award that you got in 2022. Congratulations.
Yeah.
What did that honor mean to you personally
So
and professionally?
We had just completed, I had been appointed by the Office of the President, Uhuru, to be a member of a task force for some task that they wanted us to do in the judiciary. I was extremely honored to sit with the judges, and they're very nice judges. When I really respected and appreciated judges work hard. And I was with a colleague of mine, Dr. Frank Jenga, and we did the job. And after that, normally when you're being appointed, you send in your application. And I was lucky to be granted. I was really honored. And it just tells me that the government have in place structures to look for and encourage and reward hard work and innovations. So sometimes you work hard and you feel so discouraged, no reward, something. God sees you. Yes. And I think God saw the work we did. But I know I would encourage everybody else to do the same. But I'm really honored, and it has given me courage also to come out. And so we need to continue to mentor young people and to guide young people to be successful in life all round. Yes. It's not just mental health, all round.
And you've truly done a commendable job around that, because one thing that still stands out for me, and if with the few minutes and a few hours that I've known you, one thing that is standing out from you is the fact that you get to notice things that are gaps, and you try to ask yourself, what can I do and what can I do to help? Yes. And even if it won't reach the 100, at least you've reached somewhere. And even others have reached 100, and even more generations are still carrying it with us, bringing more ideas into it, even now with the digital spaces coming up, the AI and all that. And now talking about the young mental professionals, even health professionals, what would you advise them? What would you tell them, especially for those who also would want to create impact, beyond clinical work?
Let them attach themselves, focus on... one thing I like is that we have the senior psychiatrists who are mentoring are good right now. And what I've seen in psychiatry is that even the senior consultants, they are friendly with you. Unlike many departments, I hope I'm not really criticizing other departments like medicine, surgery, and others. The young doctors do not fear us. They mingle with us, they party with us, we feel together. I think the young need to focus on your seniors and hook up with one or two consultants who will walk with and sit with, and then they will be able to mentor you. Yeah, and already I know I've mentored some who've decided to do psychiatry. They know themselves. Yeah, and but you need to mentor to be mentored. Yeah, because it goes beyond just the book, the textbook, and the curriculum you do in an undergrad. A lot of mental health you're going to learn outside. Through experience, and even through our own patients who teach us. I always say, I'm even learning from my patients, and people cannot understand that. You're always, the learning is continuous. Yeah.
If you're a young healthcare professional out there, or a mental health care professional, that's the great advice from Dr. Makanyango. Get mentored. Get at least one or two consultants who you can work with, so that, to reason out your path and to get to understand more into impact and even teamwork. Actually, teamwork. And that leads even to my last question, where now, how do you envision the future of mental health care in Kenya?
It's growing. Right now, every year we have more and more doctors applying for psychiatry. There was a time that literally, you could count how many people have applied, and I think the department at the university were worried, are we going to get anybody, But now I think with the young doctors who are mentoring others, and they're coming with innovations, and more. The list is just growing. So I think the future of mental health is great. I think Kenya is, I'm not sure, but I think we are one of the best in terms of the mental health advocacy standards. Standards. But I know we work closely with our partner countries, and they're doing a marvelous job. But the partnership with our neighbors is also excellent. But I think I would say it's bright. Our future is bright, yeah. But we are looking for excellence. We shouldn't just aim for a bright future. Always aim for excellence. Always.
Okay.
Yeah.
Okay. So now, lastly, our 2 fun questions. 2 for you, 2 for me. You ready? Okay. You want to start?
Do you aim for excellence, or do you just aim for basic?
I aim for excellence. To soar higher.
Yeah.
Yes, because for me, I'm a believer of purpose. So if you've been given a purpose, or if you've already gotten it, I'm yet to figure out if I'm yet there, but I seek God's guidance. I believe if God gives you that power, you don't have to settle. You go
More.
More. You do more.
more.
Yes.
And striving for the best.
Yes.
Yeah. Then you'll be rewarded, either on earth or heaven.
Yes.
Yeah.
Yes.
But you get rewarded.
Okay.
Yes.
So my question to you is, what's a myth people still believe about psychiatry that you wish would disappear?
It's just that okay, they think that a psychiatrist is somebody who will just stigmatize you, treat you like a mad person. You know, like when I was working in Kenyatta, whenever my fellow head of departments would tell me when they had problems with their staff, they would always threaten them, you will go and see Dr. Makanyengo. Imagine. So, I wonder, sometimes I'm walking on the corridor and somebody walks far away and said, why are these people afraid of me? Because they are made to think that Dr. Makanyengo is the punishment.
Let me ask
and,
a question.
And yet...
Sorry to cut you short, but you mentioned something that really totally comes up when we talk about psychiatry, psychology, even psychiatry. Yes, anything psych. We tend to just think you people personally too. Even right now, that was it was a question that would have just come somewhere. For me, I call it psychoanalysis. I know maybe it's yes. How do you tend to not do that? Because to psychoanalyze. Yes, people. Because sometimes when we just see you, we just see like you're just like, what, she's mental. She's exactly
psychoanalyze.
Yes, and exactly. Now that part question.
Just switch off. When I just like now I'm with you people, I don't think I'm analyzing Moses or you or.
You see, for us, we'll just be like she's still at work. She's.
No, you switch off. But now when you come with a problem, now I have to follow protocol to take history and others. But sometimes you just discern. I mean, like now when somebody is just talking too much and disruptive, the first thing in my mind is this person may have a bipolar disorder or a manic episode. Because those are obvious. But that's like if someone with a broken leg, you say it's an orthopedic case. Yeah, but people should not fear us. We are just okay.
And actually, when the fact that you also mentioned that there's stigma around,
mental health.
Yes, where someone even tells you not to tell people that I'm coming to see a psychiatrist, but a general doctor.
To change the letterhead. My letterhead is psychiatry, so. To put it at general hospital, I said, I cannot start lying because you are feeling stigmatized for something which is common. So many people have mental conditions.
Other than just that, something also that comes off, and this is my opinion, I feel like most people will also put it that, why are you just going to sit down with someone to just talk to them and them just telling you something that you already know, you just fear.
The public don't understand mental. So they tell you struggle with a very sick person, suicidal, you'd spend hours talking to them and say why you need medication to balance the serotonin levels so that within 1 or 2 weeks you're feeling brighter, and then you're going to have therapy. Then the parent says, leave those drugs. And then there are people who cheat people. You're taking psychiatry drugs. Stop them. So we have a battle there. The public need to know there are drugs that are life-saving. Why have someone commit suicide when he can be saved? He works, he goes back to his family, and is productive. Yeah.
Okay. Well, actually, from your question, it has reminded me of a time when I saw a therapist in 2022.
Mm-hmm.
Yes, and it was a great session.
Mm.
Yeah, it awakened a lot of things. It even got to make me understand why I make certain decisions, why sometimes I see life differently. And yeah,
Therapy is good for everybody. I think we all need therapy, actually,
okay.
at some point.
Yes.
Mm.
So I'll ask you my question and then you'll finish with your question. Okay. So my question to you is, in your practice, have you ever had a patient reaction or request that made you laugh or pause?
Oh, yeah.
Which
Yeah. Oh, some of our patients just funny, so funny. I can't explain what, but there's a patient I came who came to see me, was hilarious. I mean, he presented with symptoms, but he was so funny that even the staff, you know, were laughing. But not in a bad way, but in the sense of humor. But now you see him. It gives me joy that he's so well. He's now responsible. He's living with the family, because he was living alone, behaving weird, and he's so yes, we do get cases like that. Although it's encouraged not to laugh at a patient's sickness, but then when they have a sense of humor, you have to
you join it.
you join in. Yeah.
Okay.
So,
Your question for me.
have you had a challenge in your job? You're interviewing somebody and you laugh so much uncontrollably. There's this burst of laughter that sometimes you can't stop. Have you ever had it?
Yes. Yes, I have.
You remember it?
Yes, actually, I do. I do until I remember the one I was laughing with Medak, but I didn't feel off because I also have I laugh loud.
Yes.
So I was interviewing and then they said something. Mostly in this space, especially if you're not vast, which I can't say entirely I am, you'll meet some things, you'll hear some things and they define it like, oh, it's like that. And some are funny.
Yeah.
And you laugh at it and it was a he, funny enough. And he was like, hey, punguza kucheka. Like, there's a way he commented. I felt it, but then I didn't feel odd. I just completed my laughter and went on. So yeah, I've been in that situation. Yeah.
But laughter is sweet. I think laughter is good. It increases dopamine, and we're encouraged to laugh. That's part of mental health, part of holistic care.
Yes.
Yeah.
Okay.
Yeah.
So I believe that comes to an end of this segment, and you've really shared how you've built programs, how you've shaped mental health care and services, and that is such a commendable job that you have done in the mental health care and holistically in healthcare. Yes, and so for our next segment, we're going to touch on more onto you.
Yeah.
Yes, actually the spiritual side of healing, faith, ministry, music. Yes, all that. And thank you so much.
Thank you.
Okay, that's it for this segment. I hope you've got to learn more about, for me, this segment has been more on impact, growth, leadership. Actually, management came off too, because you did mention the fact that when you even joined KNH, you were very few psychiatrists. You were not even taught management. You had to learn through the job. That was your word. You had to learn through the job. So that is for the people who are watching. I hope you've learned something with this session. See you next.